Kathy, COVID-19. And Jamie is here again as well. Good morning.
Becky is also
It's
here.
nice to see you back again. You're just...
Thank you, Mr. Chair and Commissioner.
Even with all of the hard work you're doing, you can still come in here with a smile.
Yeah.
And you did, yeah, right. And you did,
Behind that smile is some tears.
yeah, well, you know what, we're still proud of our public health department here, so. All right, you did give us a handout, so we got
did,
everything
yes.
here, and
We thought we just. And so I guess Jamie, you'll
start?
start with.
Amy, good morning.
Good morning. So we'll look at the data again. Basically, for August, as of August 23rd, we have 168 active cases in Clay County, and you can see the comparison across the river in Cass County, and same thing for Minnesota and North Dakota. And just to point out that 2 board meetings ago, when we were here and shared that data July 6th, we were at 11 active cases. So we continue to see that climb. In the data that we have for positive cases for Clay County, we can see that there were 6 people that were hospitalized between August 15th and August 21st, so that would be last week. And then just want to note that we are seeing an uptick in the hospitalizations on the Minnesota and North Dakota side based on the data that we have been getting. We'll go to the next slide.
Is that data, are you provided data whether those people were vaccinated or not?
No, that what we,
Not right away, anyway.
the cases that, the 6 cases that Becky is looking at in terms of the data were hospitalized because of COVID, and that's all the information we have on that. Okay, so looking at the next slide, the Clay County active cases by age, and these are the current active cases that we have in the breakdown. And you'll see we're seeing an uptick compared to last week in that 0 to 4 and the 5. So our younger kids who are not vaccinated is what we're seeing an increase in. And then, you know, what we have been seeing is our highest overall is in that the 20s age group. We've got a peak of 21 in our 30 to 34 for this last, for our current active cases. We'll go to the next slide. And looking at the cases reported by the test date on this, the Clay County cases by week, and then the next slide shows our cumulative cases because we had, you know, we didn't have that slide last time, but we'll show you that this time. But we've got just the one case on the 22nd, but the week of the 15th through the 21st is the 123 cases there. So just showing that we are continuing to see an increase in those cases. And then the next slide, and that's the one that we have the cumulative cases. So it's more of a visual than anything. You can kind of see over time where we have had our rises, and we are rising again now. And then we'll go to the next slide. And then this slide is the doses of vaccine that public health has been providing, so our total of 15,234. And then just to show you too visually that we're continuing to have an increase in vaccinations that are being provided by public health. So on 8/15 it was 168 that week. And then we had an event at MSUM on Saturday, and we had a total of 60 students that were vaccinated.
How many?
60.
Oh, good, okay.
And then do you want me to talk now about the vaccine clinics, or should I come back to that?
Oh, sure, yeah. you can
Okay.
both those down.
I'm going to just skip to my notes here real quick just to tell you what's going on this week. But in the public health at the Family Service Center on Thursday, we have a clinic we're offering Pfizer and Moderna vaccine, and that is from 1 to 5 at the Family Service Center. And then otherwise, today, we are going to be at Concordia providing vaccine. We will be at the homeless shelters providing vaccine tomorrow, at Horizon Middle School on Wednesday, and then I think that's it for the week.
Isn't there one at DGF?
Dilworth, DGF, pardon me?
DGF this morning?
DGF, yes. Our school nurses that are employees of Clay County Public Health in the school district are providing vaccine at DGF this morning. I think that's 9 to 11. Okay, so then I'll go back to the slides.
Can I ask a question about the toast?
Yes, absolutely, go ahead.
Just want to circle back maybe to vaccine, of what you have, and if you're able to use the doses. You know, we talked before about not wanting to open a vial if you weren't going to be able to finish it. Has that been an issue? Do you still have folks that you're able to utilize all the vaccine that you're getting?
We are doing our very best to do that. What we have been doing at the end of the clinics at the Family Service Center is checking with the homeless shelter and with corrections, the jail and juvenile detention center to vaccinate. So that's kind of what we're doing with our extra doses. MSUM this weekend, the staff did a fantastic job of literally stopping a volleyball game to see if there was anyone left. And, you know, so yeah, we're doing the very best we can to use every dose we have.
And I say that because I was trying to track down a second dose from one of my children, and that Pfizer dose is difficult to find. And so we had gone to 6 different pharmacies, and because didn't have a standing appointment, weren't able to get something. So I think people should know that if you're trying to find something on a Friday or a Monday, good luck, right? I mean,
Yes.
really. And so I think that's one maybe frustration just from what I observed being in those different pharmacies. There were people that were ready and willing to have a vaccination that weren't able to for whatever reason. And I know that sometimes it's tricky just to get there. And
That is definitely a barrier for the vaccine, and, you know, the healthcare providers are saying the same thing. So if you have one person that's coming in, you know, and that to open a vial for that one person, you're gonna waste the rest of the doses. And so it is a challenge. It is making it more difficult, for sure, so.
But I will say that I called Public Health's or phone number and received a phone call right away from one of your staff to let me know about the upcoming vaccine clinics. And so continued thanks to them for making sure that they can connect folks with the vaccine if they so choose.
And we do that also, just, you know, when people do call in, we put their name on a list. And so when we have enough people for that, you know, Moderna or Pfizer bottle, then we give them all a call too. So we do try to do that every week for our Thursday clinics.
Thank you.
Yeah. So then the next slide is just looking at that state data again. The number of people with at least one dose of vaccine, and then at 69.9%, and then those with a completed vaccine. And it's just kind of looking at the age categories and the percentage of individuals that are vaccinated. So we're climbing with that 12 to 15 and 16 to 17-year-olds, but still our highest is in that 65-plus age group. So yeah, that's about it.
Becky's going to talk about the breakthrough cases.
Morning. So again, breakthrough cases continue to be very rare. This is the data that's put out by the Minnesota Department of Health on a weekly basis, and that is available for the public to view as well. We are seeing a little bit of an increase in the number of breakthrough cases, so it's at 0.321%, but still a very, very small percentage of people that are vaccinated that wind up becoming infected. And then again, the breakthrough hospitalizations and breakthrough deaths are negligible. I mean, very, very minimal. I would expect, you know, the breakthrough cases to increase a little bit week by week, just because there is so much community spread right now, and then just a game of numbers as well. So the more people that get vaccinated, there's more people that can potentially get infected too. And then this is the CDC level of community transmission. It's just a side-by-side of the past several weeks, and you can see the progression of community transmission for us in Clay County. So July 26th through August 1st, we were at yellow, which is moderate spread. 2 weeks ago, we were at substantial, so that orange color, and now this past week, the most updated data, we are at high transmission, so that red color.
When we say high, we used to always be looking at the positivity rate. How are we compared to months ago when we saw our previous peaks?
I don't think we have that data as readily available
Right,
We have,
CDC
excuse me, I didn't mean to
Yes,
interrupt
yes.
you. We do have on this for the positivity rate at the testing site, which is probably not the whole encompassing information, because if you're going to the testing site, you're more than likely not feeling great. But we do have what the positivity rates there were based on volume, but not for November, which was our spike, but you can kind of see, compare that.
And that's a positivity, that's correct, Mr. Chair and Commissioner Mojo. That's positivity rates of those that were tested at that site. So,
just
just the,
that particular site.
correct.
But in November 16th, when we were seeing our spikes, Minnesota had a cumulative positivity rate of 6.3 statewide, but our 14-day case rate was 123. And so I think what maybe Commissioner Campbell is going to is, what is our 14-day case rate? Because we need to be able to monitor same for same, so it allows us to make decisions going forward. And I agree that map is different in the last month than we've seen the past 18 months. So it's hard to compare, maybe.
Yeah, and Mr. Chair and Commissioner Mojo, that the CDC community transmission is again just one metric. So we have to take into account everything. So that's just one metric of community transmission, but we also have to look at our community and what's happening with vaccinations, what our hospitalizations are with COVID. So there's a whole bigger picture that we have to take into account.
All right, we have some more questions. I'll let Becky finish her presentation here.
The only thing I was going to add about the level of community transmission, so the CDC uses they look at the new cases per 100,000 people over the last 7 days, but also that percent positivity over the past 7 days. So they're kind of using a combination of both of those metrics to get their rating of community transmission. So it is, but you are correct, it's not the same as that 14-day case rate, so it's hard to, it's not apples to apples that we're comparing. And then the big news yesterday, I'm sure you all heard that the Pfizer vaccine for those that are 16 years and older, it has been officially approved by the FDA, so it is fully licensed like other vaccines that we routinely give to our children and the rest of the community. The emergency use authorization continues for those in the age group of 12 to 15 years, and also for the booster doses or the third dose that we've heard about recently. And then just a note that public health is not yet authorized to administer those doses. So anyone who's questioning whether they would be considered immunocompromised, we are asking that they reach out to their healthcare provider.
So all those people that were waiting for FDA approval, they now have it.
It's here, yes.
Yes, and Mr. Chair and Commissioners, we expect also, what we're hearing is Moderna and the Johnson & Johnson vaccine will be next.
I would assume it'll follow the same sequence as when they were previously approved. I suppose that's the process that it takes to have that study complete that gives the FDA their comfort.
Right. So just another additional process, but they certainly anticipate that will follow. The approval for the children that there's no vaccine approved for yet, the 5 to 11-year-olds, we don't expect that will happen for a number of months.
Oh,
There's still, it's quite a process yet to approve that for that age group, so, it may change, but it sounds like that it will be a number of months before we get that vaccine for that age group. And I think that's it for the slides we did. As Commissioner Mojo mentioned, we do have the testing activities. On the backside is the month of January, so we have January through August. I believe I mentioned at the last board meeting, I verified that this testing site will be open through the end of the year, so that's really good news. It will continue to have testing site located in Moorhead. There is also a testing site in Fargo, and they certainly accept Minnesota residents, as we, at this testing site, accept North Dakota residents. So you have the ability to get tested as need be. And then there will be testing kits, I believe, that the students, the schools will have available to them, as well as the colleges, so. So as far as, the masking, that's kind of the hot topic, as everyone knows. We've met with all of the school superintendents. We started our superintendent meetings, and so we talked with them last week about what they're going to be recommending in their schools, what they anticipate. It's kind of all over the map as far as what the schools, some of the schools are not going to make any recommendations. They're just going to allow teachers and students to wear masks if they choose to. So there's not going to be recommendations. And then, so it's a variety of things. Some are making recommendations, and of course, the school board last night in Moorhead is mandating masks. So the schools are kind of still working through some of their processes, but I think some of the schools will be starting with an optional masking for teachers and students, and that's what their decision will be. So we'll see as things evolve. So it's not consistent across the schools in Clay County, obviously, and across the state for sure. So we talked about last week, MDH and CDC are still recommending masks for people in public settings, those vaccinated and unvaccinated. I don't have that slide, but that was what we had put up last week. And so they haven't changed. They are not mandating masks. They're recommending masks in public settings for those vaccinated and unvaccinated. So going with the science and all the information, this board can make a decision about what you'd like to do, but my recommendation would be to recommend masks in our public setting. Now, keep in mind that my informal information is that Clay County employees, I know for a number of our departments, we're at 90% vaccination rate. So we're doing well with vaccinations. We continue to offer that for those that are maybe waiting for this full approval. We may encourage them to get vaccinated. We just did a large mass testing at one of our homeless shelters because across the state, that's been high-risk areas, and there's been a number. There was one shelter that was 85% positive. It's good to know that most of those 185 tests were negative. So we're really doing a good job of also reaching out, getting those individuals vaccinated as much as they'll accept vaccination. It's still optional for them. And then I think really the high-risk areas, so vaccination is number one. We want to get people vaccinated. That's just to get out of this pandemic. We need people to get vaccinated. That is number one priority. And then the additional measures come along with that. So the social distancing and masking and cleaning, but number one is vaccination. So public health's mission is to really get the high-risk areas are really the schools. When you think about those kids that are 5 to 11 years old, they can't get the vaccine. They won't be able to get the vaccine for a number of months, potentially. And they're in class all day. It's going to be all in-person learning to begin with. So really, those are areas to really think about. Those are really going to be the high-risk areas because of that group, and they're not able to. Maybe they'll social distance 3 feet, but they're not able to do any more than that. And the colleges. So some of the college campuses are requiring vaccinations now for those kids in sports, and some in the dorms. So we're really, that's, as Jamie mentioned, we've been to MSU a number of times providing vaccinations on site. We'll continue to provide vaccinations when they want us to come back. We're going to provide vaccinations at Concordia as much as they need us to, and also to M-State. And then we're providing vaccinations on site to the schools. So we really are pushing, getting as many as we can vaccinate for those that are the unvaccinated, that are at the most risk. So the reason why I say, we can recommend masks, if this board chooses to, for Clay County, we know we're not in a high risk. Our WIC program is still under a federal waiver, so we're not seeing face-to-face. We are not doing any WIC face-to-face. It's all remote. Our home visiting programs, we're not seeing face-to-face. So if there's children in the home, we're not going into the homes. If they choose to meet with us, we've been, they had the option at one point to meet outside, masking, 6-foot distancing. We're still saying masking of the unvaccinated, so we're requiring masking of the unvaccinated. So we have a number of programs that we aren't doing face-to-face. So when I say vaccination is the most important and the percentage of people vaccinated, our county employees have been really pretty good. There's still a few departments that aren't at 90%, but we're hoping to get there now.
Well, it's encouraging, the fact, and I was going to ask, I was hoping Darren would, and maybe you have an idea. I think, when we start talking about what we should or shouldn't do at the campus level, I'm kind of curious as to what level of a positivity rate might we have within our own employees, within our facilities. And I don't know if Darren or if you have any of that information that we can monitor to see how that is. And
I think it would be pretty challenging, number one.
I know it's
They'd have to go through all the employees, but also we have employees that have been vaccinated outside of our county.
Okay.
So it would be really challenging to find out exactly, we don't have a scientific percentage.
We recently opened up all of our facilities, and I know you mentioned that most of our county staff and public health and in the areas of social service, they're not doing the home visits where there's children involved, right?
Correct.
Or unless it's a case of
Child neglect.
child neglect or something that would still need to be done. With that being said, do we have a lot of clientele that are coming in, for example, to the Family Service Center? And how do you feel we should respond to those people who, I have concern that I don't want to have an additional way for our employees when they're at work with that outside source coming in. What are your thoughts?
Yeah, and right now it's, if they're unvaccinated, we ask them to wear a mask because they are the highest risk. I'm not sure how many are coming in. I can't answer for social services. I'm not sure how many they're coming in face-to-face. Do you have any idea, Jamie?
I don't, but I can say for public health, of course, we have the clinic, and we are asking people to wear masks when they come into the clinic. We have people that come in for Becky's department, licensing for food, pools, and lodging, and they are coming in, and we have clients that are bringing in documents, so it's really short contact. Typically, they come in, they bring something in or drop something off.
Well-
We had a conversation yesterday at a part of a joint public health social service meeting, and there was a discussion about really trying to limit the contact into the homes with kids. And so both of our departments are looking at, and really making sure that the parents, if we are making a visit, that they have an informed decision. So we're sharing information on what the risks are. We are wearing masks if they are requesting that we be in the home. And that does happen occasionally. The clients are they want us to come and see their home and their child. And so it's an unusual circumstance that we do that, but we're being very thorough in that.
I was just going to add that Lakes and Prairies has added to their operating procedures masks as well.
Okay. All right. Well, that's very informative. Thank you again for being here, and you'll continue to monitor and do we still want them back every week? Okay. All right, Kathy, I think it's our board's wishes to have you come back each week until further notice, and if something develops that's, needs urgent attention, be sure to let Steve know, and, yeah. Commissioner Kaylee.
Thank you, all three of you, for this very thorough presentation, and thank you for all of the changes that have been made to keep the public and our employees safe. There's been a tremendous amount of work done. And I love how there's still access to services that doesn't require face-to-face necessarily, but we're still providing those services. So thank you, Public Health, thank you to Social Services and all of our other departments for that. I do think that given all of our surrounding counties are red, except for Welcome, who is substantial, they're in orange. And all of our students are coming back to school and moving in. And again, a tremendous amount of work has been done with vaccination, but masking is important and social distancing is important too. And I think we should give some weight to those CDC recommendations and honor that. And so I would like to see us institute a mask requirement for county buildings in public spaces where social distancing cannot be maintained. And that would be in place for 14 days, consecutive days of the move back to moderate or low community transmission, unless we receive a different recommendation from public health. To me, this is not a political decision. This is just a loving your neighbor decision. We are a really caring community. You know, if there's a blizzard and your neighbor needs help shoveling their driveway, we get out there and we help shovel the driveway. And when I say community, again, I want to reiterate that I mean the whole county. I don't mean just Moorhead. This is a small thing that we can do to help take care of our neighbors. And again, it adds weight to those CDC recommendations that all people, regardless of vaccination status, should mask when in areas of substantial or high transmission and social distancing cannot be maintained. So I would make that motion that we would institute a mask requirement for public spaces where social distancing cannot be maintained, as I described.
All right, we have a motion.
Second.
We have a motion by Commissioner Kaylee, second by Commissioner Ebinger. Any further discussion?
Could I get a definition of that motion again?
Yeah, I would move that we institute a mask requirement for all public spaces in county-owned buildings, regardless of vaccination status of the person entering, in areas where social distancing cannot be maintained, and that requirement would remain in place for, until we have 14 consecutive days of a return to moderate or low transmission in our county. Pending requirements from public health.
Thank you.
I guess I want to know what that definition of moderate to low is. I've seen high and I've seen substantial, and what is that a category by the CDC?
It is,
Okay,
yes.
I just wanted.
Yep, they list their 2 indicators at the bottom on their website that shows the community transmission map. And so low transmission level would be new cases per 100,000 people in the past 7 days, but they also use it in conjunction with the positivity rates, so below 5%. Moderates would be 10 to 49 cases per 100,000 and a positivity rate of 5 to 7.9. Substantial is 50 to 99.9. And then the percent positivity rate 8 to 9.9. High is greater than 100 cases per 100,000 people in the past 7 days, and positivity rate greater than 10.
Any further discussion? Commissioner Mojo.
Thank you. I said this a little earlier in my comments, I just want to make sure that we're being consistent in whatever method we use to discern actions moving forward. And the part I struggle with is the transmission rate has not necessarily been the rate at which we've made decisions previously. We've taken CDC, Minnesota Department of Health, and Clay County Public Health all together, the three of them, to make sure that we make decisions. And, you know, I just don't have enough history knowing what the transmission date or data is. And so I kind of struggle with that. And maybe to go back further is having children in the Moorhead Public School District last year, we knew that if cases, the 14-day case rate was 14 to 20, it was this, or 25 to 50, this is what this means. And so I kind of struggle not having a good grasp on what the transmission, different categories are. Have we even been in those lower two categories in the last 6 months? I don't know that. I mean, so I kind of do struggle with that. And then going forward, I also struggle that we as a board spent millions of dollars of federally allocated funds to make sure that we put provisions in place to allow us to safely move forward out of COVID. And so, you know, I'm not trying to make this a mask, no mask thing. I truly feel that we put parameters in place that keep our staff safe, that keep the public safe. We have the ability to have a remote work environment for folks that may not feel safe. We also have the ability for folks to work if they're in quarantine, or citizens that may not want to come in face to face can do virtually everything remotely. And so I do really struggle with the inconsistency in how we choose what a mandate would look like just based on the data that we use. And also the fact that we set our county buildings up to really be as safe as possible. Furthermore, I don't know what is a squad car, a public space. Does that make, because that's a shared space, if they pick someone up, does that mean that our deputies wear masks all the time? I just think there are too many gray areas for us to create a policy right now that, personally.
Obviously, I've had experiences where I know this is a real deal. COVID is a real deal, and I take it seriously. And at the same time, I still have to look at, weigh everything in different ways. And Becky, one of my key concerns, and it was one of your very first comments, is regarding the breakthrough rates, and they're very low. You said it yourself, and the numbers prove that. I'm very concerned about, and that's why I asked a few questions earlier, I'm very concerned about our people and our buildings. But I am extremely pleased to hear that we're probably looking in that 90% range that are vaccinated. And when you take that into consideration within our buildings, and that's why I was kind of interested to know, okay, if we're going to have something within our buildings, what's going on in our buildings now to make us want to do that? And I don't, going to kind of what Commissioner Mojo said, I don't have much evidence that there's a lot of transmission happening within our facilities. And again, it goes to what we've done over the past year to make sure we protect our people. All you got to do is go over to the new DMV, and you can see how significant that is in protecting our employees and also protecting the patients that are in there doing the social distancing. So there's an awful lot of things that we've done. I also know, personally for me, wearing a mask, I have a hard time with it. Not that I'm against it. It's that when it comes to me, I'm very uncomfortable, and my breathing is is impacted by it too. And so there's that component of it. I do have concern in regards to the public coming in that, you know, we don't know to what level their vaccination rate is. You know, so I do have that concern. And from what I gather already, the recommendations that you have out there would suggest that if somebody comes to visit one of our people, whether it's in public health, I would imagine if you have citizens coming into public health or if they're going into our social services, those people are being asked to wear masks, are they not?
Correct. We for sure ask if they're vaccinated, so we want to know that, and definitely require a mask. If they're not vaccinated, they're required to have a mask.
Okay. Oh, I don't know. I guess I'm struggling with this one from the standpoint of what we've done, and you know, I think we have some county employees who would probably like to see it, and then we have some county employees who feel comfortable the way it is now. You know, so, Commissioner Ebinger.
Yeah, I seconded this because this is a discussion we need to have. A lot of the provisions, the things we've done in our facilities over the last 18 months will provide a degree of social distancing and barricade people between each other to where I don't think all our employees are going to have to wear masks all day. I had an eye appointment yesterday, and I sat there with a mask on for 2.5 hours. I don't like it, but it didn't kill me. If I get COVID, it could. Or if I've been immunized, but if I shed COVID virus and I'm asymptomatic and don't know I'm doing it, I could kill somebody. The chances of that happening are remote, but they're there. And I just feel inside our facility and under the scrutiny and direction of our supervisors, so people can have a space where they don't have to sit there with a mask, but where if they can't maintain social distancing, they have to wear a mask. I just think it's prudent. We saw a very courageous decision by our school board last night. They were brave enough to admit in their initial analysis they feel they were wrong. And for elected people, that's a hard thing to do. But I admire them for what they did. I think looking at these numbers we've seen this morning, and the fact that another variant may come out of what we're looking at now, one that can be bigger and badder. We need to get ahead of this. People need to get their immunization, and to some degree, we have to use masks. So that's my conclusion on this. I hear my fellow commissioners, and I know we've done a lot here to try to limit spread. If there's a little bit more we can do, I think it's worth it.
Commissioner Mojo.
Thank you. I just would like to clarify that one district in our community chose that. We are a county with several districts, and not all of those districts have done that. And I don't think it's about saying that they were wrong. What they said at their first meeting, where they chose what the policy would be, is they would follow the CDC, Minnesota Department of Health, and Clay County Public Health. And if that were to change, then their recommendation would change, which it did in the last week, and that's what they decided. They did say that if the case rate goes to those same parameters that I talked about, that then it would be removed. And so I think it's important to remember that we're not Moorhead, just Moorhead. We're all of Clay County, and so it's taking all of Clay County into account. And at this point, personally, I will always give folks the opportunity to choose in which they want to make decisions. And I think that putting the parameters in that we have really protected staff and I believe will continue to protect the public.
Can Kathy, can I ask you a couple questions in terms of, obviously, I think of our outlying facilities like the highway department and some of those places, and it's clear that in those areas, the resolution or the motion that was made by Commissioner Cayley just wouldn't apply. It just wouldn't apply to certain areas. So I want to want to dive into primarily the Family Service Center and our law enforcement buildings as well. And to what level that you know of, would there be areas where we wouldn't meet the ability to social distance? And including our new government center.
Well, I
put
think.
you on the spot here, but
Yeah, Mr. Chair and Commissioners, I think, for example, in my department, we really still use remote when we have meetings, because we really don't have meeting room space where we can keep distanced. So our meetings are, I know Jamie does a lot of remote meetings. She has so many nurses, so they can be in their offices and still remote. We do our interviews remotely still with new employees or applicants for employees. So we really don't, I mean, if we're trying to get a number of people in our meeting rooms, that wouldn't work because we don't have enough space to social distance. I don't believe there's any gatherings or many gatherings in the lobby area of that Family Service Center building. Usually people are coming in and going to where they need to be. We're not seeing we're certainly not seeing the quantity of people coming in just because we have so many programs where we're still doing remote. So I don't know that people are sitting in that, the area where the vending machines are. I don't believe anyone are congregating there, so I'm not sure. Most people have their individual offices, so if they would have a meeting where they can't 6-foot distance, we're still telling them that, especially the unvaccinated who are at the highest risk, that you need to, if there's anyone that's unvaccinated, they need to wear a mask. The areas that probably, like the detox and the juvenile detention, certainly are areas where we're attending to the needs of those individuals, but they've always been under a different requirement because they need to be conscientious of the people they're serving, whether they know if they're vaccinated or not. So they continue to wear the masks. Our tenant in our Family Service Center building is the dental area. They mask. Obviously, they require.
and they
that.
require their clientele that comes in to wear masks as well.
Correct.
Already.
And so the meeting rooms, if we can social distance and stay 6 feet away, and then the unvaccinated wear a mask, but we're just not doing a lot of that. We're still doing so much remote meetings. So unless
I guess that's
colleagues
what
have
I'm
anything
trying to get to. It just seems to me that within our facilities and within what we're doing, we're already accomplishing a lot of this.
And Mr. Chair and Commissioners, we're certainly happy to, if there's some other data that would be helpful, I'm putting Becky
Yeah.
on the spot.
Well,
But she's, she can dig into some further data, if that would be helpful. You talked about the positivity rate and 7-day case rate. We're happy to provide whatever we can.
I think back to the 90% of our employees who have did the right thing and had their vaccination and putting a requirement on them within a facility where the ability to have the transmission of a virus, even if they were to carry it, is probably extremely low. And again, it goes to what we've already done with our ability to social distance. You look at this room, I'm hoping everybody's 6 feet apart. I look back there, it's pretty close, but should be. But I'm thankful that this motion's been brought up, and I I don't know that I'm going to support it today, but I want a little bit more information. And I would actually like to see Steve bring this. I mean, our management team has reviewed things before and talked about issues. And I think the management team should talk this over, Steve, within your management meetings that you have. And let that play out based on what Commissioner Cayley and Commissioner Ebinger have proposed here. And see, does it go too far? Does it not go far enough? I think having the input from management, and of course they hear from their individual staffs amongst them, and the sooner you can do that, and if it comes back with some additional data that really shows the concern, then I'll support it. But at this point, I just don't. I'm kind of in the camp with Commissioner Mojo's comments here, based on what we've done, and we were extremely aggressive in the areas that we've done to prevent the spread of COVID within our facilities, to the tune of millions of dollars. So I've made my comments. We haven't heard from Commissioner Gross. I don't know if he cares to comment or not, but good morning, Frank.
At this point, we've got these people here recommending to us what's been necessary. We've been following what they've been recommending, and I don't see why we should oppose that. I fully support the mask. As soon as they say we should put masks on, I'm going to support that fully.
And right now,
They're not recommending it yet. So.
Yeah, Commissioner Cayley.
It is recommended that they're wearing masks, it's just not a requirement.
Not mandated.
It's not mandated.
And can I ask a question?
Sure.
Because you said, it's very unlikely that if somebody is vaccinated and asymptomatic could spread if they were infected, and I just want to get a clarification.
Oh, I don't know that I said that.
So Becky, can you talk about transmissibility from a vaccinated person of the Delta variant and what that is looking like?
Sure, so there has been data to support that someone that is vaccinated, if they become infected, they are able to spread it to others. There was a recent outbreak investigation on the East Coast in Massachusetts. I don't know if you all are aware of that, where there was a lot of spread from the vaccinated individuals to other vaccinated individuals and unvaccinated. So yes, it is possible.
The only thing I referred to is the breakthrough rates. That's the only thing I referred to. All right, any further discussion on the motion? Seeing none.
Roll call vote, please.
Oh, okay, we have roll call vote, please. Yes.
Did you get her a new one? Just get her your. Give.
So you would just like me to restate my motion?
Well, what's going on there?
Me too. Okay, we'll try with multiple mics, see what happens. Are we hearing me now? Okay. My motion was that we institute a mask requirement for all county-owned buildings in public spaces where social distancing cannot be maintained, and that this requirement would remain in place until we have 14 consecutive days of low or moderate transmission in Clay County or until we get a different recommendation from County Public Health.
All right, so we've had that motion and that second, and we've had our discussion. And Commissioner Gross has asked for a roll call vote. Ms. Clean?
Commissioner Gross?
No.
Commissioner Mojo?
No.
Commissioner Campbell?
No.
Commissioner Ebinger? Commissioner Kaylee?
Now, having said that, I still would like to go to Steve, and I would like you to have this as a topic of discussion for the management group of Clay County. And so you're getting all the management involved, and I want to be able to hear back what they think. And obviously, they're going to know of what the proposed motion was, as Commissioner Kaylee had it now. And, you know, if they share the same concerns within their, we might hear something different from Highway than we might hear from other buildings too. So I want to know that. I don't want, because I voted no today, to think that I don't think COVID is an issue. Trust me, I know COVID is an issue. And I'm still looking at our active case rates, and I know it's even doubled in the time we've talked about this. At the same point, it is still far cry from what it was, you know, when we were having. The sad part about it is we've spent a significant amount of time this morning talking about masks, and masks isn't the solution to this problem. Vaccines are the solution to this problem. And I know that there's a significant part of our population who don't want to be told to be vaccinated. I get that. I just want to point out the fact that the majority of new cases of COVID are coming from unvaccinated people. The significant number of our hospitalizations, Becky, I think you would agree with me, are coming from unvaccinated people. And if we want to beat this, that's where we beat it. And these are nice comfort things that we try to do. But until then, until those people are vaccinated, I had a conversation with Commissioner Ebinger before this started, and we could end up having, if those people don't get vaccinated, we could have different variants showing up and going to those people unvaccinated, and we could end up we could be wearing a mask for the next 30 years if we don't fix this the right way. And that's my commentary for the day. Sure, yeah, Commissioner Ebinger.
Yeah, I'm glad we had this conversation. I'm glad the conversations are taking place out there. Ultimately, we've been given 3 primary objectives to reach, and that's vaccine, masks, and social distancing. We've got a huge part of our population right now that has not been susceptible to severe cases of COVID that are with this variant, and that's our kids. And until we can get them vaccinated, we're going to have a lot of, it's like the same thing as every parent's found out when you got a kid in school. They come home with every bug that's out there, and it generates it. And it's a tough thing to ask them to control that at the school level. But I'll agree with Commissioner Campbell. People need to get vaccinated. And anybody hearing this, that's the primary objective we've got in keeping ourselves and keeping others safe. So I hope these conversations continue, and I hope those that are out there that haven't made a decision yet will listen. Thanks.
Thank you. All right, well, this has been a good discussion, and I Kathy and Jamie and Becky, thank you for being here, and we'll see you next week. And Steve, you got your kind of marching orders from, at least from me anyway, to have that management meeting. All right,
Thank you.
have a good day and continue the fight with vaccines there. All right, let's move on.